Thank you so much, all of you, for being here today and for the incredible work, for the extraordinary seva that you're doing in the communities right now. Let me first of all say a special thank you to Minister Mendocino and Minister Sani for being with us today, but also for their service, for their seva. We are extraordinarily lucky that people of this caliber and this quality have chosen a career in public service, and these two individuals are doing extraordinary work for the community. So I want to say thank you to both of you for the work that you're doing. Minister Sani, in particular, gave away her secret just now, if you weren't paying any attention. Her biggest secret as a leader is she is also an extraordinary mystery shopper. She tries every phone line, she calls every number, she checks every service that's available herself to make sure that they're working the way they're supposed to be working. And that's just one example of the incredible dedication that these folks are showing. So I'm coming to you today from my fully equipped home studio here in upper northeast Calgary, as I understand my neighborhood is now called. It's actually my dining room because me, like all brown people, we only use the dining room when there's fancy guests coming over for dinner, and there haven't been any of those for years. So I've been able to repurpose into this place where I can do these calls and communicate with people. You know, I'm a Northeast Calgary kid. I was raised in this community, I live in this community, and it has been extraordinarily difficult for me over these last many months to see the case numbers rising and to see so many of our neighbors become ill and pass away from this terrible disease. And certainly for me and my colleagues at the City of Calgary and Calgary Emergency Management, you're about to hear from another extraordinary leader, our brand new chief, Sue Henry, who is not new to emergency management, but new to her new role. But for me and my colleagues in Calgary neighborhoods, which is the part of the city that looks after social services issues, it has been very alarming for many months to see the numbers rise in Northeast Calgary and to really try and understand what is happening in these communities. And I don't need to tell any of you that there's been a lot of misinformation about this. There's been a lot of comments that put this down to culture or race or the way that people live, none of which are particularly accurate. What is going on here in Northeast Calgary is two things. Number one is many people have jobs that you can't do from home. Folks are working in essential services, they're working on the front lines, and they've got to go to work every single day. And here in my neighborhood, you know, even at the height of the lockdown in the spring, the traffic patterns didn't change that much because people were going to work in healthcare, in retail, in personal services, and they needed to continue doing that work. Number two is, as you know, we have large households here in the Northeast. Some families have lots of children. Many families are blessed to have grandma and grandpa staying with them. And that means that a lot of the public health messaging that we've been trying to put out to the greater community, if you're ill, isolate at home so that you have your own bedroom and your own bathroom, which is not practical in many of the homes in our communities. And so as a result, we are in a situation where people are at risk. And many of the things that we're asking everyone in the entire community to do are things precisely designed to protect those who still have to go to work, to protect those who still cannot isolate at home. And so the challenge is not communicating to Northeast communities that COVID is a bad thing and you should take precautions and you should wear a mask and you should stay 6 feet apart and you should wash your hands. All of those are incredibly important. But that's not really, for me, the core of the conversation we're having right now. For me, the conversation we're having right now and the critical thing that we have to communicate through to our communities is an idea of people's own rights. Can I call in sick? Will I get fired? Is sick pay available to me, or do I give up that day's wages if I'm not feeling well? Can my cab or my license be taken away if I'm calling in sick and I'm not driving a full shift? If I'm unable to isolate in my home, what are the options that are available for me or for the vulnerable people in my home? And I feel like those messages are the ones that have not been getting through as well as they could have been, whether it's due to language barriers or cultural navigation. We got to do a better job. And so a few weeks ago, I had the opportunity to be in a phone call with the Premier and with the Mayor of Edmonton, in which the Premier was expressing his concern about what was happening in Northeast Calgary. And you know me, I'm very quiet and shy and retiring, and it's hard for me to make my opinion known. That's not true at all. I was pretty darn forceful in making my opinion known. And at the end, the Premier said, I think what we need to do is set up some sort of a community task force of people who understand the community and who understand the agencies that are working on the front lines, and ask them for a plan. And I said, Premier, I'll get you one in 45 minutes. Now that I've heard you say that, because I knew that all of you and all of these extraordinary agencies, whether Center for Newcomers or Action Dignity or Immigrant Services Calgary or our faith organizations or so many other, had already been working on it. So all I had to do was make one call. I called Anila. And she said, well, I'm just in the middle of a meeting talking about this. And I said, great, get me a plan and get me a budget as soon as you can. And within a few hours, we had a plan and we had a budget that I was able to share with Minister Sani and with the Premier, because these agencies have been working on these issues since the very beginning. Sometimes with some support, sometimes with little support. They did what they do. You did what you do, which is driven by the concept of service, the concept of seva. You got to work. And you've been working on this since March. So what we're talking about is nothing new. But what we're talking about now with the East Zone Collaborative is something that finally has some money behind it, that finally has some real political support behind it from all the orders of government, and that has the ability to really make a difference in people's lives. Because ultimately, this is what this is about. This is what I'm reaching out to all of you to help us do. For a lot of folks to say, I need to take Nani and Nana away, grandparents away, so that they can isolate and be safe for a couple of weeks, that's difficult. It's inconvenience. And for a lot of us, it feels wrong. How can we send our parents away? But I'll be very blunt with you. It's a lot less inconvenient than illness. It's a lot less inconvenient than organizing a funeral. And ultimately, these are the messages that we need to be able to get out to our community, that these supports are here, that you have rights, and your governments are standing behind you to support you in making sure that you stay healthy and you make the right choices. And that's where we need your help. We need the help of cultural ambassadors. We need the help of leaders in our communities to be able to really get these messages through. There was a point 2 weeks ago where Upper Northeast Calgary had a higher infection rate, active infection rate, than any country in the world. Think about that for a minute. We're putting our neighbors in enormous risk. Thankfully, the numbers have started to come down. But, earlier this year, we said that any neighborhood with a case count of over 50 cases, 50 cases per 100,000 was on the watch list. We are still over 1,000 cases in Northeast Calgary. It's 20 times the watch list. The numbers are trending in the right direction, but we have an enormous amount of work to do to keep everyone safe. And I got to tell you, I'm feeling very emotional being with all of you tonight. This has been a long 10 months. It's been a tough 10 months for so many of us and for so many members of our community, but we're almost there. We can see the light at the end of the tunnel, but that light is still many months away. And ultimately, we must keep up our discipline. A mayor of Slovakia told me early in all of this that discipline is the best vaccine. And ultimately, I think that's our job, to keep up the discipline, to keep everyone safe. So the last thing I'll say in this portion is, the thing I want to remember about 2020 is I want to remember all the bad things, all the mistakes, all the things that make us stronger. But I also want to remember the good things. I want to remember that our entire world changed, I hope, irreversibly, because we realized that our own interests and our own comforts were not what was important, that the sacrifices we were being asked to make in our lives were not to protect ourselves, because God forbid I get sick, or Anila gets sick, or the ministers get sick, or any of us get sick. We're probably going to be okay. But all the sacrifices we're being asked to make are for the people who are not going to be okay. And I think that for me, the lesson I take away from this horrible year is that it is possible for every one of us to work in a frame of compassion and caring and looking after others and making sure everybody is going to be okay. So I want to say thank you to all of you for the tremendous work you've been doing all these months. Let's keep it up. Let's keep people safe, and let's get to the other side of this.